In our last video, we discussed how Anthem Blue Cross Blue Shield, Anthem BCBS, had announced a policy that would limit the coverage of anesthesia during surgical procedures as a cost-cutting measure. Here's a brief recap. Policy intent: Anthem BCBS proposed using physician work time values from the Centers for Medicare and Medicaid Services, CMS, to set a maximum time limit for which anesthesia would be covered during surgeries. This was intended to control costs by preventing what they perceived as overbilling by anesthesiologists. Impact: this policy would have directly affected patients in states like Connecticut, New York, and Missouri. If a surgery ran longer than the predetermined time, patients might have faced additional out-of-pocket costs for the anesthesia beyond that limit. Exceptions were made for maternity care and pediatric patients under 22 years old. Backlash: the policy was met with significant opposition from the medical community, particularly from the American Society of Anesthesiologists, ASA, who argued it could compromise patient safety and lead to financial burdens for patients. There was also considerable public outcry on social media and from state officials concerned about the implications for patient care and rights. Reversal: following the backlash, Anthem BCBS decided not to proceed with this policy change. They issued a statement explaining that there had been significant widespread misinformation about the policy, and they clarified that it was never their intention not to cover medically necessary anesthesia services. Instead, the policy was meant to align with clinical guidelines to ensure appropriateness in anesthesia use. This decision by Anthem BCBS highlights the often contentious relationship between cost control and healthcare and patient care quality, demonstrating the significant influence public and professional opinion can have on insurance policies.